This video lecture is for study session 2 of NSA 303. Now, before one can fully grasp the nature of the concept, it is important to understand the foundational factor that has influenced its growth over the years. Community health nursing is a product of centuries' responsiveness and growth. It accommodates the needs of a changing society. That is why this study session is focusing on historical development of community health nursing. On completion of this study session, you should be able to explain the 4 stages of the historical development of community health nursing. You should be able to highlight the specialty of community health nursing, and finally, you should be able to enumerate the factors that influence the growth of community health nursing. Now, historical development of community health nursing. In order to better understand the historical development of community health nursing, the historical development was divided into 4 stages. That is the early home care stage, the district nursing stage, that's between the mid-1800s to 1900s, the public health nursing stage, that was between 1900 to 1970, and community health nursing stage, that was from 1970 to the present age that we have. Now let's take these stages one after the other so that we can understand them better. The early home care stage, that was before the mid-1800s. During this period, female members of the family or friends took care of the sick at home. The main purpose of giving care was to reduce suffering and promote healing. The foundation of home care nursing was laid by religious and charitable groups. The early home care stage emphasized on preparing nurses and supervising care, as well as providing solutions to patients' problems, and this laid the foundation for modern community health nursing. So that led us to the second stage. So the next stage is the development of community health nursing, was the official organization of visiting nurse or the district nursing. That is between the mid-1800 to 1900. The main purpose of the district nurses are to care for the sick, but they also educate people on cleanliness and healthy living. Nightingale referred to them as health nurse. Emphasis on prevention and health nursing became one of the distinct features of district nursing, and later of public health nursing as a specialty. The work of district nurses concentrated on the care of individuals. District nurses recorded temperature and pulse rate and give simple treatment to the sick and the poor under immediate direction of a physician. The third stage is the public health nursing stage. This stage was between 1900 and 1970. At this stage, district nursing had a broader focus, which was to include the health and welfare of the general public and not just the poor. This brought about public health. Since a larger group of people were now included, special programs such as infant welfare were put in place, and this brought about health care and health education to the public. Nurses also had opportunity for more independent work and to improve their nursing education. And the last stage is the community health nursing stage. The advent of the term community health nursing brought about a new era, while public health nurses continued their work in public health by the late 1960s and early 1970s. Many other nurses, not necessarily practicing public health, were community-based. At this stage, confusion set in between the meaning of public health nursing and community health nursing. The terms were being used synonymously, and yet they have different meaning in their fields. In 1984, the Division of Nursing convened a consensus conference on the essentials of public health nursing practice and education in Washington, D.C. That was around 1985. This group concluded that community health nursing was a broader term referring to all nursing practices in the community regardless of their educational qualification. Now, specialty of community health nursing. The two main characteristics of any specialized nursing practice are specialized knowledge and skills and focused on a specific set of people receiving the services. Now, talking about the specialized knowledge and skills, as the name implies, a specialized nursing practice involves acquiring specialized skills and professional etiquette so as to perform effectively. So that is why we have a specialty in specialized knowledge and skills. And the other one that focuses on specific set of people that are receiving treatment. This gives a specialized nursing practice that has a focus on particular area or specific set of people. That is what makes it special. For example, community health nursing is mainly focused on dealing with health problems of the community, most especially the vulnerable population. Community health nursing as a specialty combines the knowledge of public health and skills that help in taking care of problems of the community with focus on vulnerable population. It means bringing together the knowledge from the public health science and professional nursing theory to improve the health of community and the population. Now, there are some factors that influence the growth of community health nursing. This factor has significant ones, and the significant ones are: the first one is advancement in technology. With increase in technological innovations, healthcare service and nutrition became enhanced. The second one is progress in causal thinking. With more technological advancement, knowledge about causes of diseases become broadened, and it helps community health nursing to control health problems by examining all possible causes and then thinking tactical causal points. The next factor is improvement in education. When people's knowledge of their environment is broadened, there is an increased understanding in the health aspect. As a result, people feel that they have the right to inquire and know the reason behind the care they are giving. Another factor is consumer movement. As a result of improvement in technology and education, consumers are more informed, and now they demand well-coordinated and comprehensive care. And the remaining factors are demographic changes and economic forces. We have come to the end of this study session. You can consult your study material to have more understanding about the subject that is being discussed in this video better. Thank you for listening. See you in the next class.